I'm Rich Prager. I am faculty at the University of Michigan in adult cardiac surgery, and I am a deputy editor of the Annals and have been a deputy editor actually for about a year. Well, admittedly, this is a new role, being on the editorial board, but I think as I reflect on a very busy year, that this gives a deputy editor an opportunity to really see what people are thinking about, how they put studies together, and opportunities to really share what they do with the large audience who read the Annals. And so that you become a very important purveyor of information. And while for some of these people it may be their first attempt, it's a magnificent attempt and should be recognized. And for others it's a continuation of what they've done and have had a career doing. And those, those differences may be noted, but are critically important to have their thoughts, their science in the Annals. So you become really someone who has the opportunity to review a great deal of hard work by many people and play an important role in having these thoughts and studies and trials get into the public domain in a magnificent journal. I think what many of us see now is using technology, number one, to help our patients, and we certainly want to stay abreast of that. Two, using other methods of study, in other words, embedding studies in large databases such as the STS, the three arms of the database, if you will, so it is easier to do studies, frankly, and embed them in the database, as well as welcoming contributions from many people throughout the world, where there may actually be a large number of patients who have had different approaches that would be very important for all of us to see and learn about and perhaps even adopt. So I think this is a very important role as we look at how the specialty is changing and what, for example, the Annals can bring to the specialty. I would encourage everyone, as I have learned during this past year, to be fearless and submit things to the Annals. Because I think, one, you're going to teach us something, and two, a rejection is not failure. And I think we all have to learn that, and we're not in a very good specialty that learns that well. We don't accept failure. And that's actually the good part. It doesn't mean what was done or you submitted was not good. It just means at this point the way it was submitted, or the number of patients, or the aspects of the study may not be ready for publication. So while it is an emotional setback, I would encourage everyone to submit things that they have worked on, they have done, they are passionate about. And while we can't rewrite papers, as I've learned, we can certainly give suggestions that can improve something or can improve a concept, so that a year or two later something comes back. What I've learned personally over the last year, and even before that, when I had the opportunity to review manuscripts, not as a deputy editor, is that I've come up with many reasons. I think the first reason we accept manuscripts, if I could turn the question around a little bit, is because we think readers, thoracic surgeons throughout the world, would be broadened by reading this, one. So I think that remains the kind of the platform from which I work. So if you turn that around, then why would I reject it? And I don't think any of us like to reject, but why I would reject it is if there wasn't enough supporting information in it. And that doesn't necessarily mean patient numbers in a clinical study, but perhaps the way the cohorts were organized, that it wasn't clear enough, that there wasn't discriminating statistical evidence to move it so it teaches all of us something. And it's because of that that some of these manuscripts don't quite fit yet. But then turning it back around, if you provide feedback to the authors who spent a lot of time doing this, it can yet be improved and be resubmitted. The question of how all of us decide to become a thoracic surgeon or cardiothoracic surgeon, we all probably have different answers, but its appeal to me started junior high and high school, when the field at that point in time was just evolving. I was fascinated by it, and I think I figured that if you just work hard or work harder than anybody else, you might be able to do this as you grew up. And frankly, for me, that was my mantra: just keep working hard and see if you can get to this, what I thought and continue to believe is one of the pinnacles of medical care and a medical specialty.